First, I'd just like to welcome everyone, and I'm going to do a few introductions. We have a lot of people on hand from a lot of the partner organizations that were involved in this, so I just want to make sure that people know. I'll introduce kind of the people that we have on the panel specifically, but just wanted to mention that we have individuals from the Denver City's Road Home, we have individuals from the Office of Hope at the city, and then we also have partners with Enterprise Community Partners, the Corporation for Supportive Housing, the Evaluation Center at the University of Colorado, the Mental Health Centers of Denver. Let me just make sure I'm not forgetting anyone else. We have a lot of people. As we've always said, this project really took a village to kind of create and bring together, and that's one of been the highlights of the program overall, is just the amount of people that were able to come together really to focus in on specific outcomes. So the reason why we're here today is it's the first outcomes report for the Denver Social Impact Bond Project. The Denver Social Impact Bond Project started way back in 2014 with a lot of development work and the mayor announcing that he would like to move forward with a project really being able to house 250 of our most vulnerable individuals in the city. And he announced that at the Clinton Global Initiative. In 2016, we were able to finally actually serve the first client as a part of the project. And the overall goal is to get to at least 250 individuals. The individuals engaged here were individuals that we had seen come through the criminal justice system at very high rates for very low-level offenses and had behavioral health issues that were better served in a housing and supportive development environment. The social impact bond actual tool is trying to allow the city to make that adjustment from kind of remedial programs, that being jail and other behavioral or other safety net services, to proven preventative programs. And the way that the city has able to contract that is through a contract that is outcome related. And there are two primary outcomes that are being addressed in that outcome report, and we'll talk about all of those specifically. The first is housing stability. So is the program successful in actually engaging clients and getting them housed, and how long they're actually staying in housing over time? The second is, did the program actually see a reduction in jail use days among the population? And that's a report that is not the subject matter of today, but will come at various different parts of the project itself. So today we're actually looking at two reports. One is an outcomes report that is really going over the housing stability outcomes that we've seen over the first year of the project. And the second report is a one-year report on kind of the intricacies of the program and a lot of the lessons learned that our partners and everyone that around the table has really seen. To date, over or close to 200 individuals have actually been housed as a part of the program. And by early 2018, we hope to get up to 250 individuals. And that will come with the opening of a new building, which is about a block away, and then the recent opening of MHCD's Sanderson Apartments, which just to give a little bit of kudos, was just named one of the state's Eagle Award winners for innovations in housing construction and design. So we're really encouraged by both the kind of quality of buildings as well as the efforts that we've seen on the ground. I'm going to shortly turn it off to our partners who can explain a lot more of it, but I just wanted to highlight a couple main things that I think have been really encouraging coming out of the program. Number one, our partners were asked to really engage and house a population that wasn't really engaged in seeking services before. And I would just say the efforts to kind of actually go out on the streets, find individuals, and then work with them to get in housing has been just tremendous. And I think it's been a really tremendous effort by both the actual MHCD, the Colorado Coalition for the Homeless, but also the supportive partners behind them. And one great feature of the Social Impact Bond has been everyone coming around the table to problem solve. The second major part is that we're really starting to see the results. I mean, housing stability is one indicator that we really believe represents larger kind of outcomes, whether it be reductions in jail bed day, better health outcomes for individuals. But the most important outcome that hopefully people will go over is how it's changed individual lives. Because at the end of the day, I think that's why we all got around the table and really were working hard to make this program go forward. And that continues to be at the forefront of the work we do. So with that, I want to introduce who will be speaking. So to my right, we have Sarah Gillespie and Mary Cunningham from the Urban Institute, who is the independent evaluator for the Social Impact Bond effort. I don't think I introduced myself. I'm Tyler Jekyll. I'm a program director with the Harvard County School Government Performance Lab and a fellow with the City of Denver working out of the Department of Finance. We have John Parvinsky, the president of the Colorado Coalition for the Homeless. Lisa Thompson, director of Housing First for the Colorado Coalition for the Homeless. And then we also have many more partners in the room to answer questions. And and Manny, who is a program participant who has been housed as a part of the program for the Colorado Coalition for the Homeless. So with that, I'm going to turn it over to Mary Cunningham.
Great, thanks, Tyler. Good morning. As Tyler said, my name is Mary Cunningham. I'm the co-director of the Metropolitan Housing Community Center at the Urban Institute. The Urban Institute is really honored to be a partner on this project, to be working with the city and so many organizations and people who are working to end homelessness in Denver. At Urban, we care about data and research. We want to make sure that policy and programs are evidence-based. We believe that good data leads to good outcomes for people. And so we really work hard to follow where that data leads us. Supportive housing is one of those programs that we believe is informed by the evidence. Over the past few years, there's been a significant investment from the federal government into supportive housing, and that's led to some national declines in chronic homelessness. If you know anything about the budget process in Washington now, you can see that those investments are going to be decreasing, and largely because of the big HUD cuts proposed by the Trump administration. And in fact, programs like these are filling in the gaps to fund this evidence-based approach. We think that investments in supportive housing could lead to, ultimately over the long run, decreases in chronic homelessness in Denver. And the program that we're here to talk about today was informed by the evidence. We all sat around the table, we looked at the research, what was working, what the program model should look like, what the target population should be, and used data to inform those program design decisions along the way. And today, we're here to talk about the first results from the effort. So our role in the Denver SIB, along with our partners at the Evaluation Center at the University of Colorado, Denver, and the Burns Institute, is to track the results, as Tyler said. We designed a 5-year evaluation that collects quantitative and qualitative data and measures whether or not the program is meeting its goals. The study is a randomly controlled trial, the gold standard in research. The program launched in early 2016, and since then has enrolled about 200 homeless individuals, and will enroll about 50 more, as Tyler said, by the beginning of 2018. So in a minute, I'm going to turn it over to my colleague, Sarah Gillespie, who's going to report on the early results, housing stability outcomes for the first 100 individuals who enrolled in the program for the first year. And in a few years, we will be able to look at the results the impact of the program. So really isolate what's driving the results and look at differences between those who received the supportive housing and a control group that didn't. So we're excited about these early results, and I guess I'm going to stop talking. Without further ado, I want to turn it over to Sarah.
Great, thanks. So as Mary noted, the supportive housing program has enrolled almost 200 participants at this point. Before supportive housing, these participants had experienced long periods of homelessness, cycled in and out of jail and other emergency services, and those systems had not been meeting their needs. So to break this cycle, the program is providing supportive housing. In the first year, Colorado Coalition for the Homeless enrolled 100 people. So in 2016, 100 people were enrolled in the program. I'm going to talk about the initial program results for these 100 people. Ultimately, we also want to know if the SIB is working. And there's 2 ways to look at whether the SIB is succeeding, and that includes both program performance and how much the city is repaying the lenders. So let's start with program performance. The first 18 months of the program provide promising evidence that the program is exceeding or meeting its housing stability goals. So participants are getting housed and staying housed. We have a few indicators to look at housing stability. Of the first 100 people referred to the program, we have 6 months of data after their referral. And so for those 100 people, 93 were located, 88 were engaged by service providers, 73 had their housing applications approved, and 66 signed the lease and moved into housing. So these are important milestones in reaching the program's goals, and we know that the numbers are only increasing as we track more than 6 months of data. After 6 months, 95% of participants who entered the program had no exits from the program. They remained in housing. After 1 year, 89% had remained in housing. And then of the 40 participants who could have been in housing for at least a year or had a planned exit, 33 were stably housed during this period, and 6 had a planned exit from the program. Only 1 participant had an unplanned exit, and many of those initial 100 participants are still reaching the 1-year milestone. So based on these numbers, the program is outperforming the initial project projections from the financial model. That model presumed approximately 80% of participants who entered the program would stay housed or have a planned exit. So those numbers, that the indicators we just looked at, show that the program's outperforming those initial projections. So because jail days are subtracted from days in stable housing, we also looked at jail days among these first participants. The average number of jail days among those in housing for at least a year or who had a planned exit is 8 days in the first year. So again, in this area, the program is outperforming initial project projections, which predicted that on average, participants would spend 34 days in jail in the year after housing. As Mary said, once everyone is enrolled in supportive housing in the program, we'll be looking at differences between the group in supportive housing and the control group. So in terms of repayments to lenders, the other way to look at how the SIB is succeeding, through the SIB contract, the city agreed to pay about $15 for each day each qualifying participant was stably housed and not in jail. Qualifying participants are those who spent at least a year in jail or had a planned exit from the program. So by the end of June 2017, 39 qualifying participants had spent a total of 12,457 days in housing, and that's what's resulting in the city's payment of just over $188,000 to lenders. So this payment represents over 95% of the projected success payments based on the financial model for this period. The difference is due primarily to permit and construction delays, which led to slower than expected lease-ups. But in 2016, the project developed a revised leasing plan to mitigate the effects of these delays on future repayments to investors. And if the project continues to meet these revised leasing targets, the lenders may recoup the initial difference in repayment. So with that, I just want to reiterate what a pleasure it is to work with all of the partners here in Denver and turn it over to CCH.
So I'm John Parvensky. I'm the president and CEO of the Colorado Coalition for the Homeless, and have been in that role for a little over 31 years now. We're sitting in the Stout Street Health Center, which is one of our flagship programs that provides integrated health care for both chronically homeless individuals, other individuals and families who are homeless, and continuing to provide that care once they move into housing. We're pleased to be part of the Denver Social Impact Bond Program because it elevates the work that we've been doing for many years to address the most vulnerable people within our community, and has, with a very rigorous evaluation component that the Urban Institute brings to it, is able to reinforce what we know from our experience, what works and what needs to happen in order to end homelessness in our communities. We started doing Housing First, which is essentially permanent supportive housing targeted to chronically homeless individuals, by providing initial housing and then wrapping supportive service around that housing to help individuals maintain that housing, address their health, mental health, and addiction needs. We started doing that 15 years ago. And over the last 15 years, before the social impact bond was started, we were able to house 400 individuals and keep them housed at about a 90% housing stability rate. So when the city approached us in terms of the social impact bond saying, can you do this? We said, of course we can. We've already been doing it for years. What we lack is the ability to bring it to scale in order to address what we know is the unmet need on the streets. And so I think that's what this program allows, is the new funding source, the social investment, and the repayment by the city based on demonstrated results, based on what we know works to make a difference in the lives of folks that you see every day on the corners and on the streets, in the alleys of our community. Tonight there are still 1,000 individuals on the streets of Denver without shelter, Metro Denver, I should say, and another 1,500 in emergency shelter. And so with this head start in terms of the expansion of Housing First through the Social Impact Bond Program, we know that we are making a difference. If it weren't for those programs, the numbers would be tremendously larger and the impact on our community significantly more tragic. But expanding this and bringing it to scale, we're starting to see folks that we never thought, or many never thought, would be able to move into housing and stay housed, achieve that goal. Tyler mentioned that we will be completing construction on the Renaissance the Renaissance downtown lofts, just a block away, providing 100 units of housing for the social impact bond population. And we have used scattered site housing vouchers to house the remaining folks that we have in this program. Now, having said that, we know what works. I think the initial results are showing that it continues to work, but it's not easy. It takes a lot of work, a lot of commitment, a lot of compassion, and a lot of problem solving from not only dedicated staff, but working in partnership with those on the streets and working in collaboration with agencies throughout the community, with the city, with our mental health partners, with Denver Health, in order to achieve those results. And part of that is the approach that we bring in terms of trauma-informed care to individuals, meeting them where they are, engaging with them, and helping them to realize that there's a better life available for them. And when we're able to do that, it's not only better for them, but it's better for the community at large. And ultimately, we can demonstrate that it's cheaper and costs taxpayers much less when we achieve that. So I'm going to turn it over to Lisa Thompson to talk a little bit more about that service approach.
Yeah, so I was asked to talk a little bit about the lessons learned over this past year, as well as what we'll be changing or looking forward to in the coming year. And as John said, I think one of the first lessons learned is what a tremendous, dedicated, compassionate, amazing staff that we have here at the Coalition who've really committed to seeing this project become a success. We really couldn't do it without the SIB teams, without the housing intake and placement team. So just thank you to the staff for all of your work on a daily basis with this. In terms of the other lessons learned, I think as John said, one of the most important lessons that we've learned is really the importance of community partnerships in order to make this be a success. Our partnerships have really been instrumental in terms of outreaching and locating individuals initially and then moving people into housing. I think the other lesson learned is that the majority of people that, when offered housing and supportive services, readily accept those services. I think sometimes that people have a false belief that people choose to be homeless, but this project is really demonstrating when the resource is there, people readily move into housing. We've also learned the importance that there must be adequate housing and housing options available for people. So many of the people are not successful in their first housing placement, and with housing options available, we are able to relocate them into more successful housing placement options for them. And I think as a nurse, the idea that people need housing and a safe place to heal is really intuitive and just seems like an obvious thing. And I think the program staff, we all know on a daily basis that the work we are doing is transforming lives and even saving lives. And I think we're really grateful to be a part of a project that can really quantify that and measure that so that other people can really see that the impact that this work is having. I think that of the exits that we have had, the majority of those exits have been a result of client death. And I think that that really speaks to the highly vulnerable group of people that this project is serving. And it also speaks to the need for partnerships with local hospitals and the local health partnerships that must all come together to really provide housing and supportive services to this population. And then in terms of the coming year, we've certainly made course corrections throughout the year and have adjusted as we've needed to. I think in the coming year, we're going to be moving from obviously locating people to really providing the wraparound, intensive, supportive services and programming that's going to be required moving forward. I think that it's important to know that housing is really just the first step, and that the healing really takes place once people are off the streets in housing and can really focus then, away from just survival mode of being on the streets and really focus on their lives and recovery and the healing process. And so that's what our staff will be working with individuals for the coming year on. So thank you.
Thank you. So I'm going to give just a couple brief thoughts on how the program relates to the city, and then we'll turn over to Manny and questions. Sorry, I forgot the mic again. So in looking at kind of how this program relates to the city, I think there's really three ways to look at it that were kind of designed on the original city goals. One, would this program get people who are vulnerable off the streets and into housing and help to make sure that they stay in housing for the longest period of time? The second, are we shifting people away from remedial resources to preventative resources that have a direct impact on their long-term outcomes and lives? And the third, is the city paying for results and paying only for results? And I think on all three of those measures, the early indications are yes, the program is moving very successfully. So on the first measure, through the tremendous efforts of MHCD and CCH, we are seeing people being engaged at very high rates, being housed at very high rates, and then staying housed for long periods of times. John will say that he knew that they could keep people housed that long, but I think nationally it wasn't the case, and so it's really tremendous to see kind of the early results on how many people are remaining housed and for how long they are. On the second area, shifting resources to proven preventative programs, the early results I think are starting to prove this out a little bit. We'll know as Urban does a full evaluation of the program, looking at everything from kind of healthcare costs to jail bed day reductions and other city services. But if you look at the early jail bed days and other kind of tangibly related outcomes, we're seeing reductions based upon what we saw before. So we are starting to shift resources to those preventative programs. And the last, paying for results. The city is paying for housing stability days, and the more that the city pays means that we're getting more outcomes that are of value to the city. And that's exactly kind of why we're here today and why the outcomes report identify kind of how the city is doing this. And this has been a shift in different than typical contracts, but I think is really showing how the city can partner with its nonprofit partners as well as the larger community to really figure out ways to better fund housing and ensure that the city is paying for outcomes, but our providers are actually getting the flexibility that they need to do the great work each and every day. And the last part, I think, is just talking about the partnerships and how it's connected to other larger city initiatives. So I want to, Reggie just joined us. Reggie is the executive director of the Office of Behavioral Health Strategies, where the SIB project really started at the city, really taking a look at how it related to our court system and our jail system. And that office has really taken a much larger holistic view of how do we actually put lots of different programs and policies together to ensure that we are connecting individuals to the right level of treatment and then getting them to longer term resources. And the SIB is just one of those larger areas, and definitely Reggie's available to answer questions, but connecting those all together is a part of a larger system transformation where we can actually set up a preventative system rather than kind of the status quo that we know is costing us a lot and not reaching the longer term outcomes. And then Eric Sullivan is here, who has been working on the City of Denver's 5-year affordability plan. And the SIB and supportive housing, as well as the connection to health, has become a major part of that plan and efforts of the city to move a lot of those initiatives forward. But then I'll ask Leavitt, I mean, a lot of the people in this room have been working on this project in many different ways. So I personally have never been on a project where we've been able to get so many partners into the room in a problem-solving mode, all really working collaboratively together to really drive towards our larger mission, is to ensure that we can actually house the greatest number of individuals, provide them with the support that they need, and actually make progress on some of our larger social issues. So with that, I'm going to turn it over to Manny if you want to talk a little bit about your experience with the SIP program and CCH.
Good morning, my name is Manny Valdez. I'm a participant in the SIP program. SIP team number 2, which is an excellent team. I really feel lucky and blessed because it's like Mr. Tyler said, they actually came and found me while I was still in the streets, and they worked really hard at getting me housed, and I just feel really, really lucky. There's still days like I wake up today that I can't believe that I'm finally in my own apartment. I think it's an excellent program. They're helping me out with staying out of trouble, staying out of jail, keeping my doctor's appointments so I can get my health back together. And it's just really building me up. It's an excellent program. As long as you want to work it, they're there for you. Everybody I've met through this program is really, really good, really cool. They help me in any way they can, and I think it's an excellent program. It's helped me out a lot.
Thank you, Manny. So at this time, if people do have questions, we'll take questions. The other specific areas that we'll have a limited availability for a hard hat tour to actually go see the Colorado Coalition's new building. So no, that's available. So Courtney, do you want to be in charge of picking people for questions?
I had a question for Lisa. You mentioned that the majority of the folks who exit the program had to do with that. Actually, can you talk a little bit more about that? Any specifics?
Well, many of the individuals that we're working with have had chronic health conditions that really just haven't been addressed during the time that they've lived on the streets. And so many of the folks, once they get into the services, we're able to link them to care. And unfortunately, it's just too late in the care continuum. And so they've passed away.
Do you know how many?
I believe it's been 6.
6. Are those the ones that are counted as planned exits?
Yes, they were.
What's the meaning behind that term? It's probably not what it sounds like.
Yeah, sure. Do you want to speak to that?
Yeah, so it speaks to the vulnerability of the participants and the fact that we use planned and unplanned exits. They count differently, and so planned exits are still participants whose housing stability days count, because there's no, the goal is to not penalize the service providers for that type of.
That's right.
Exactly.
A planned exit could also be someone who moved to another permanent housing option that didn't require subsidy.
Mm-hmm.
I think one of the important things to know is that many of the people who have passed away have been reconnected with their families, which has been tremendously healing in that process when they've been disconnected, from their family and supports, and have been able to be housed at the time of death, or getting proper care in the hospital or in a hospice setting.
And that's been consistent to what we've seen over the years, is that homelessness, life on the streets, takes a tremendous toll on one's health. Certainly mental health and substance use as well. And so housing, while so critical, is not a magic bullet. It doesn't reverse the effects of that over the years. And we're seeing, end-stage liver disease, for example, from years of alcohol use. Once they're in housing, that doesn't necessarily turn around. But what we are able to do is to get folks the appropriate treatment to both address those chronic health conditions, address the mental health issues, reduce the substance use, and for many, that is making a difference. Unfortunately, it doesn't work for everyone.
Several of the individuals, I think, had metastatic cancer who unfortunately was just detected far too late in the beginning.
One of the stated goals of the entire program is to sort of save money overall and thus justify the use of city funds. Is there anything that you can point to besides the sort of the population itself, the 100 or so folks you've picked, that shows that you're saving money beyond the population, i.e. fewer jail visits, for example? Something that's sort of tangible that the city can point to and say, this is how we're saving money. We're not just backfilling, we're not just saving money for these folks, which is great, but the overall intent is to still save money to justify the payments. Can you point to anything that says, this is what's working, we're decreasing the jail population, and we're saving money here?
So ultimately, we will be able to say that. I think what we're saying now is that we're looking at the early results that are showing that the jail days are lower than expected. And as we said earlier, over time, we'll be able to measure the results between the differences with the group that got supportive housing and then a control group to really be able to highlight those differences. So
How will you measure that based upon, is it going to be upon jail visits or homeless jail visits, or what's the measurement stick for that?
it'll be days in jail.
And you would expect to see a decrease in the not just with this population, but overall, you would expect to see a decrease with that population as well, with the people who are not in the program.
So let me answer that. So, I mean, we never live in a stagnant state. Things are always changing. The city of Denver is a growing city. We've had over 100,000 people move to the Denver in the past years. So we're not working in a world where I can control every other thing that happens. What we will be able to prove by this study, which is probably the most rigorous in the country when it comes to supportive housing, is that this particular group, as compared to a group that did not receive services, did not go to jail. So when you're talking about savings and you're having to actually budget out into future years, I would have had to incorporate that into my budget. So if we said there were thousands of days in jail by this group, we can say that we reduced this amount by that tangible amount. We might see another group go into the jail and replace them as actual people in the jail, but we would have already seen those other people in the jail. So we would have had to budget into the future for both, not only this group, but that other group. So that is savings over time. It's just we never live in a stagnant world where we can actually say this or that change every single dynamics. But I think over time, given the efforts that you see not only from this program, but from a lot of other efforts at the city of Denver, I think we'll start to see a reduction, especially among homeless individuals coming to jail through all of the combined efforts coming together at once. Yeah, so the program is designed, the city of Denver really created an outcome-based contract that says we want to pay based upon these two outcomes that we can see. So we want to be able to see housing stability as well as tangible reductions in jail bed days. And so that's a contract, 100% performance and outcome-based. We could have gone to the Colorado Coalition, MHCD, and said, here is a great contract for you. John and MHCD need to be able to hire individuals and actually deliver the program over the course of a 5-year period. And so there were lenders, primarily philanthropic as well as a commercial lender, that provided that kind of working capital over the course of the 5-year period to allow John and MHCD and the Colorado Coalition to actually prove out the program. They get their money back based upon the success of the program. Yeah, and so there's two kind of distinct parts. We're talking about housing stability. There are particular foundations that receive payment based upon reductions in jail bed day, which will come at the end of the program.
With that in this $188,000 that's being announced now, where does that fit as far as repayment? For the private investors, does that count as a profit? And if so,
At this point, because we were delayed in one of our buildings being able to come online early, the total number of housing stability days available for repayment was lower than expected. So right now, the payments are below kind of their initial investment, but not too far below, so that doesn't result in a return on investment. But the program itself is performing at a much higher rate than anticipated before. So now that we've actually been able to work together to come up with a new housing leasing plan, we should be back on track. And if the outcomes are consistent with what we saw, it would result in a return on investment.
What do the investors think about that?
I think that I won't speak on their behalf, but I would say from all program partners that the program results are extremely promising. The kind of delays in construction are things that I don't think any of us could have anticipated the degree and nature of. And so I don't think anyone was really enthusiastic about those different portions. But when it comes to the program actually engaging with clients, getting people housed, and the kind of rate at which they're remaining housed, it's been pretty impressive.
Were the delays with Sanderson or with Renaissance or both?
So those have been delayed, but we've been able to kind of work together to actually ensure that individuals can be housed a little bit more on track. The delay that resulted in less housing stability days available was early on with North Colorado Station.
I don't think it's not a question. I just wanted to say that the SEAL program is pretty good. I consider them a simply incredible bunch of people. They go out and they seek used cars knowing that they are active. If they go out purposely seeking a lemon, their all intentions of making lemonade, turning that glass to the half full to half empty. I'm one of the programs too. Thank you.
Thank you.
How many people in Denver actually fit the criteria to be included in this program, and what would it look like to scale the program up to include, some significant portion of them?
Yeah, so we actually identify folks who are eligible for the program using Denver Police Department data. And so we've got targeting criteria, and we just refreshed the list, and there's about 2,300 folks on the list.
And it was based largely off of days in jail? And
It's 8 or more arrests over 3 years.
And transient.
And transiency, yeah.
Yes.
Yeah.
So that,
And that number is through the lens particularly of looking at the jail population. Another piece of this and something that we'd like to explore expansion, we think expanding this to the full number of folks who are cycling in and out of jail is important. We have another cohort that may not ever touch the jails, but they're cycling in and out of our emergency departments, out of our detox centers, out of our hospitals at great cost to the healthcare system. And, when we look at this, and while we're only measuring the reduction of cost to the jail system, we believe that this will show also a reduction in cost to the healthcare system. And if we can expand this approach in terms of permanent supportive housing targeted to high utilizers of healthcare services and turn that around in terms of diverting them from those more expensive emergency health system resources to supportive housing, that will also have an impact of reducing the investment of the general public, even individuals in terms of the premium that you're paying on top of your insurance premiums to be able to hospitalize folks without resources. We think that would, there's even a broader number of people that could benefit from this type of approach.
And I would just add one thing on scale too. Denver's not unique. I mean, if we go to any community in Colorado, or unfortunately any community across the country, we could probably see the same phenomenon of the correction system being the #1 provider of mental health services. And so when we talk about going to scale, I think there is great opportunity within Denver, but I also think there's tremendous opportunity from regional partnerships as well as further engagement for the state. And just to mention, the state has been incredibly engaged and involved with this project, as well as thinking about other projects where they can use now some marijuana funds, but additional housing funds to support programs like this.
One or two more questions.
Okay, so, reading this correctly, I just want to know what is the savings to the jail? So if we paid $188,000 to house these folks for a year, 39 people for 1 year, what savings to the jail?
So this is the housing stability report. So it's particular to that one outcome. So we don't have that quite answered yet, because the items that will need to come together to actually create the jail bed day reduction numbers is, number one, we need to have a large enough group that we can actually compare it to a similar group that did not receive services, so we know whether or not we actually saw a jail bed day reduction. And then after that point, it would actually be using many of the similar calculations that we saw when we did the initial analysis on this, of what's the value of a jail bed day, and then how many jail bed days did we actually see reduced.
When do you anticipate having that report out?
So it'll depend, I'll turn to Urban, it'll depend a little bit on the timing of how many people get engaged, because you need a certain full number to be able to look at different parts. The full report will come out at the end of the program, with the possibility of additional information coming close to year 3 or 4.
So, but the payments to the investors is calculated independently of the savings to the jail?
It was based upon kind of projection, so it was saying if we actually saw this amount, this is what we project we could actually be able to see. We'll have kind of concrete knowledge through urban study of what actually occurred, and so I hope the projections are very similar, but it was based upon being able to say this is what we actually see a housing stability rate equate to other outcomes, or this number of jail bed days actually equate to what we see in the system.
Last one. Do you have any idea what how much it would take in private investment to get these 2,300 served? And is there a cap that the city would get to, where you pay investors at a certain point?
So for the program, trying to build out for 250 individuals costs roughly around $50 million. That's not just including the CIV investment. So we'd need a lot of partners coming together to really bring things together. And I think the majority of the funds that I think were usually used to support these programs came from the federal level. So now state and local governments are asked to do a lot more than they ever were asked to do before. So I think everyone would love to flip that switch and be able to house everyone, but we're kind of working to kind of develop new resources and ensure that we can target the right individuals.
That 50 million for 250 people, is that a capital investment, or is that?
It's including the actual cost to build the building, sorry.
And then it covers the program for how many years?
That would be at least 5 years.
So 50 million for 250 people for the capital and 5 years.
Yeah.
But the capital part will be available
For over
hopefully
100
for
years.
40 years. So
And is a lot of capital funding federal pass-throughs, or is it variety?
a lot of it is low-income housing tax credit, so essentially pass through the tax expenditures, but with investment from private banks and investment groups, as well as some direct home funds through HUD that come through the city and the state. And, you know, and speaking of housing, it would be remiss in not just pointing out that this work has been done against the housing crisis that we're facing, which made it that much more difficult. And when we talk about housing delays, lease-up delays, a lot of that was caused because of the tremendous housing boom that's happening now that is making it more difficult to get building permits in hand, inspections in hand, those types of things, as well as to lease up private housing with landlords who can now charge much more than what the federal vouchers allow to pay. So, you know, with the work that Eric Sullivan and the mayor's housing advisory group is doing in terms of looking at expanding the affordable housing supply generally, and the permanent supportive housing for vulnerable populations specifically, that's a down payment, but unless we continue to invest in that, we're going to see more folks come out the other end, lose their housing that they're holding on to by their fingernails right now, and join this homeless population. So part of what we need to do by proving this proposition is also that we need that continued investment in the affordable housing and permanent supportive housing so that there are actually places where we can move people off the streets into housing and keep them housed for good.